So the first thing to know about ModuLex 5.5 is that it's not just a new screw, okay? It's really a comprehensive procedural solution that includes implants. This includes modular tulip heads, screw shanks, rods, and set plugs. It also has a very neat revision connector that allows you to do, which we won't talk about too much tonight, but it allows you to do minimally invasive adding on when you have to do an adjacent segment. But in addition to the implants, this system has a truly optimized retractor system, as well as a modular distraction system, which is useful in a variety of indications, including tulips, osteotomies, etc. It's really a comprehensive system. And regardless of what your workhorse procedure is, when it comes to posterior instrumented fusion, whether it's a posterolateral fusion, a minimally invasive midlift procedure, an open TLIF, a PLIF, and whether you like to do cortical screws or traditional pedicle screws, this system really gives you unlimited options and unparalleled visibility. And we'll kind of try and show you this with our cases tonight. I think the other thing I want to really emphasize is that this system is fully compatible with every aspect of Medtronic's ABLE system. ABLE is Medtronic's ecosystem of enabling technologies that includes O-arm, navigation, stealth, as well as the Modular robot. And this system is fully compatible with each of those enabling technologies. So first, let's look at the screw shanks. There are two basic types of screw shanks with this system. There are cortical shanks that you see here, the blue screw shank up in the left-hand corner, which has a fine thread pitch, narrow thread pitch that's designed for cortical trajectories and getting ideal fixation in cortical bone. There's also the ATS shank, which is designed to be placed with a tapless workflow. So I've really kind of fallen in love with the ATS shank when I'm doing traditional pedicle screws. If you're doing an L3 to S1 fusion or an L2 to the ilium, skipping that tapping step on every single screw at the end of the case can save you 20-25 minutes on the case. All the screws come in a variety of diameters as well as lengths. When you look at the tulip head is placed at the end of the case with a head inserter, which is very reliable. So the heads have a one-way connection, meaning that once you put them on, they're on forever. It's a one-way connection. You cannot take them off once they're inserted. But the advantage of this is that it gives you real security that head is not coming off. And in 2 years of experience, I mean, I think the first year that we were using the system, I used to pull on every head after I inserted it. I've never been able to get one to come off. And clinically, in over 2,000 cases, we have not seen any failures with the heads. And then obviously titanium rod, set plugs have again been optimized for this system. So that's the implants. The second really great revolution, I think, with this system is the retractor. You can see it here. It has a modular frame, and then it has the blades that you see in the upper left-hand corner. You can see that they have a slightly aggressive toothed end that's designed to really grab the muscle and not let go of it, so muscle creep is not an issue with this. The blades, you can see in the upper right corner, the blades are designed to have an offset, so the back end of the blade is far away from your wound. But the real revolution for me, when I do my TLIFs, is that before, when you'd be doing like a midlift or a minimally invasive cortical screw procedure, when you'd want to drop your hand to try and get to the center of the disc space and work across to the contralateral side, oftentimes you'd be bumping into that retractor. But these blades have a nice cutout in the middle that's designed that when you drop your hand, the shaft of your instrument is landing right in that cutout. So you can get to every single corner of the disc space when you're doing your TLIF without any difficulty whatsoever. The retractor system also allows you to do about 22 degrees of out-towing. If you like to do that to expose your facet joint a little bit better, you can. And it's also completely compatible with the scintillant light system that can give you absolutely perfect visualization of the anatomy while you're working. So so we talked about implants, we talked about the retractor system. Then the final cool thing with this system is the modular distractor. So whether you're doing a tulip procedure, whether you're doing osteotomies, oftentimes you really want to get good interlaminar distraction. So in the old days when I did mostly traditional pedicle screws, I was always worried about distracting on screw shanks. But now with cortical screws that really sit in extremely hard bone, we do a lot of shank-based distraction with tulips, with osteotomies, and we'll show you that in a couple of our cases later. This system has 5 different footprints. You can do shank-based distraction using, if you look at the different footprints in the upper part of the picture, there's an eyelet, there's a hook, there's a disposable lasso that's flexible that really kind of easily grabs the screw heads, or I should say the screw shanks, and allows you to distract on them. And then if you want to do more traditional distraction across the lamina or across the spinous processes, we have those foot plates too. So there's 5 different foot plate options, and all of them slide seamlessly into this modular frame, which again, you can see in the picture in the lower right, how it gets completely out of your way and is again, has enough offset where it's not in your way at all. So it gives you great distraction and really helps you visualize the anatomy while you're doing your work.